Everyone, welcome back to Axon Health. Today we are going to talk about the potential benefits from co-management. I'm going to stay on the topic of physical therapy and chiropractic, but this can go towards any other profession in the healthcare system: acupuncturist, occupational therapist, medical doctor, surgeon, so on and so forth. So there's a lot of misconception and animosity sometimes between chiropractic and physical therapy. And what this really comes down to is ego. And it's not good for anybody. It's not good for co-management, and it's not good for the patient. When you become a chiropractor or a healthcare provider, physical therapist, and so forth, the patient is number one. And your ego has to be taken out of the equation in order to provide optimal care. There are some things chiropractors might be better at. There's some things physical therapists might be better at. And sometimes a patient might just need physical therapy. Sometimes a patient might need chiropractic. Sometimes a patient only wants to see a chiropractor or only wants to see a physical therapist, and so forth. So there's a lot of different variables that goes into this particular topic. But what happens a lot of the time is you'll meet a chiropractor who might bash physical therapy, or a physical therapist that might not bash chiropractic, and they don't know too much about it. Or you might have a physical therapist who is afraid to tell his peers that he actually enjoys working with chiropractors, and afraid of being judged. So it's multifactorial, like almost everything in life, and context dependent. But the problem is when it comes down to patient care, there is evidence for certain things at certain times. Chiropractic manipulation, specifically for, say, low back or the lumbar spine or SI joint, can be really good for acute care, increasing ranges of motion in the joint itself, and then having a physical therapist come in and maybe do some stabilization exercises through a greater range of motion. And one thing I want to talk about, so we have stability, okay? We have joint mobility, the joint itself, and then muscle flexibility, the muscles themselves. And they all play into each other. Chiropractors are notably a little bit better with joint mobility, and physical therapists are a little bit better with stability. But this is why working together can be really beneficial for a patient depending on whatever condition they have and so forth. But I know for myself, I think that another example I'll give, but it's also a big passion of mine: exercise physiology and rehab, and I like to stay up to date with the research. I know how to rehab an ACL. But we have to think about it in this. If you're working with insurances, you probably won't get reimbursed as much money as a physical therapist, if not at all, because this is something that they do for a living. If they work in maybe an inpatient facility, and they strictly do this type of stuff all the time, right after someone has surgery, they might stay for a couple days in the ER and so forth. So there are different things that the patient can benefit from, like I said, with having chiropractic and physical therapists work together. One thing I like to say is, I said it before, and I don't really have a lot of evidence to support this, is, if they're working back to back in the same session, seeing a chiropractor before the physical therapist, that way I have the potential to increase the joint mobility, range of motion, whether it's the cervical, thoracic, lumbar, spine, so on and so forth, and then the physical therapist has the ability to stabilize different range of motion exercises in a wider range of motion. Whether that range of motion is temporarily or stays a little bit longer, it doesn't matter, but the short-term range of motion increase gives them the ability, if they go right into physical therapy, to have some more stability through a greater range of motion. This is why I believe working together can be really beneficial for the patient. And as I said before, it really does come down to the patient. And patient preference is huge. So if you're watching this and you enjoy physical therapy and you don't enjoy seeing a chiropractor, or maybe you're a little bit nervous of manipulation, especially in the neck, the cervical spine, there's nothing wrong with that. There's plenty of people out there for everyone to help, and so forth, and for good business. And there might be some people that enjoy seeing a chiropractor only, and they don't want to see a physical therapist. Although I don't fully agree with that, it's up to them. That's why patient preference is the third triangle, or the third piece of the evidence-based triad. So as I said a million times, empirical data, the evidence, anecdotal experience, or experience as a clinician or so forth, or anyone, and then the patient preference. So patient preference is huge. If a patient doesn't enjoy seeing a physical therapist or a chiropractor or a massage therapist or acupuncturist or anything, then they won't enjoy their experience. And then we have to look at human nature, and if someone doesn't enjoy something, there's more than likely going to tell other people they don't enjoy it or they shouldn't go there, which is fine. People are allowed to say what they want. But yeah, so that's one of the things I wanted to talk, well, the main thing I wanted to talk about in this video, because I think it's really important when it comes down to co-management. And again, as I said, people like different things, and there's different evidence for different care plans for seeing different people, but it all comes down to what is best for the patient. So I hope you guys enjoyed this video and have a great day. Thanks for listening.